Hi, this is Dr. David Green, founder and CEO of R3 Medical Training. Today we're discussing Autologous Adipose SVT Training. Hi, this is Dr. David Green, founder and CEO of R3 Medical Training. Today we're discussing Autologous Adipose SVT Training. So first of all, who is R3 Medical Training? Well, the company was started by me 3 years ago in order to assist practices that either we're working with or that want to either start regenerative therapies or just obtain new skill sets to do that in a hands-on setting. Everything we do, we try to do in an experiential format where it's to see one, do one, and have one mentality. We've had a banner the last few years, and now we're getting awards such as 50 Smartest Companies of the Year, Most Innovative, USA's Leading Regenerative Therapy Services Provider. So the umbrella of R3 companies is all through the regenerative campaigns with training, biologics, protocols, IRB research, so on. So one of the things that you'll notice about R3 trainings is that it's either you're watching or you're doing or you're having. It's really not just didactic like most meetings are where people get up and talk about, research that may or may not come to fruition in 5, 10 years. No, these are skills that you're learning that you'll be able to take back to your practice and use, the following week. So, for instance, here you have one of the trainers, Dr. Chavez, who's an expert in hair restoration, walking through an attendee, performing a procedure on another attendee, and then, they switch afterwards to continue. But it's really so much better to learn that way. Here's another picture during one of our ultrasound musculoskeletal injection guidance classes with one of our trainers who's a board-certified pain doctor supervising an attendee doing a procedure on a veteran. We have a Heroes program where we perform about 20 to 30 procedures on veterans every workshop, and it's fantastic. The veterans do very well, and it's completely free for them. So there's a lot of studies out there that show just how important experiential learning is. Here's just 2 of them. In the top one, they worked with medical students, and then at a year they gave them tests and showed that over double pass rates for the ones who had experiential learning. And then below, this was on cataract surgery where they compared experiential versus conventional, and both of them were effective. It's not that, watching it on video is terrible, it's just that doing it is better. And in the wet lab group, the gain of knowledge was statistically significantly higher. So at this point, our training classes are in person and live stream. We have courses in San Diego and Nashville, and then other cities I'll show you in a little bit. But we do have 2-day courses that are either for comprehensive stem cell or regenerative aesthetics. So for those people who want to focus on hair and face and sexual health, the regenerative aesthetics is the way to go. And the ones who want to do a little bit of everything, the comprehensive course is best. And we offer these courses now in person and virtual live stream, so you don't have to leave your home or office in order to take the course if you don't want to. So what is autologous adipose therapy? Well, it's essentially removing fat from the patient and then processing it for use in the same patient. So there's several different ways to do it. One thing that you need to know up front is that adipose cells are fragile, so the more you centrifuge or the harsher you treat them, there's a high chance of them dying. Not all techniques for autologous adipose are FDA compliant or clinically effective. So there's regular adipose stem cell therapy, and then the 2 most common are SVF versus SVT. SVF is the one that involves taking out fat and then using collagenase. The FDA does not like that. In fact, there's some legal maneuvers going on because they consider that maximal manipulation, which means they consider it a drug. If you're going to do SVF, you have to have a hood at your practice and use the enzyme, and it's a lengthy process. Whereas with SVT, which is what we teach, stromal vascular tissue, you don't need any of that. So adipose versus bone marrow is really no comparison. With the SVT, you get a higher number of stem cell progenitor cells from an equivalent amount of tissue harvested. It really is less invasive. Patients like the fact that they also get a liposuction with the procedure too. Adipose stem cells have increased proliferation and differentiation capacities. And in a study in 2017, they showed that the sub-Q native adipose tissue was not affected by the donor's age in terms of senescence and the yield of stem cells. Whereas with bone marrow, all of that is a problem. It can be painful. It's a fairly invasive procedure. It's a very sensitive area if you roll your fingers over your iliac crest. Past the age of 50, stem cells in the bone marrow drop to about 1 in a million. It's like a needle in a haystack. And the stem cell activity declines as well. So even if you do get a decent amount of stem cells, they are not going to be nearly as active as the ones from adipose. So why you should obtain the adipose skill set. SVT is FDA compliant. You're not using any enzymes. You don't need a hood. The FDA does not consider that to be maximal manipulation. It does fall within the minimal manipulation guidelines. We don't know exactly what's going to happen with the FDA legal maneuvers with SVF. We also don't know what's going to happen in May of 2021 with the FDA and regenerative therapy regulations. Okay, it might be that they lean more towards autologous. We don't really know, but with this procedure, you don't need enzymes, you don't need significant capital equipment, you just need normal, minimally invasive surgery stuff, and the kits themselves are really all inclusive. They have everything in there that you need, except for drapes and things like that. This is an in-office procedure. You don't need to go to a surgery center, and it really is excellent for all types of aesthetics and or musculoskeletal opportunities. So this is a video that we took at our last training with Dr. Sabrina Sult. She is our expert trainer for the SVT. She does over 100 of these a year. And essentially what she's doing right now is using betadine to sterilize the area and making sure that she can pinch enough adipose area for the procedure. And now she's draping it out so that it becomes a sterile field. And now what she's doing is just drawing up some numbing medicine, and you'll see she's just showing it to the crowd and then gonna inject it with a bleb, and that will be her entry point with her minimal incision there. And there you go. So next, she opens up the kit, and this kit, the SVT and Telefat kit, is really all-inclusive. It has all the cannulas that you're going to need. It has all the syringes that you're going to need. And what this is the tumescent liquid, which is basically saline plus the numbing medicine. And this will be what she uses to really numb up all the adipose tissue throughout the abdomen area. You can see that she's showing the cannula there. It has a nice little openings, nice lot of openings in order to go in all different directions. And this is basically the technique for numbing up the area for the eventual adipose aspiration. One thing we like to point out is if you look at her face, she's not in any discomfort. This is a very comfortable procedure. And now we've fast forwarded to where the numbing is done. She's waited about 10 minutes to let it take effect. And now the aspiration of the adipose is occurring. And at some point here, you'll see her face again. She's having a conversation with Dr. Sult and smiling, actually. So she's going through different cannulas. You end up getting about a total of 30 to 60 cc's, but you have to get enough to, depending on what areas you're going to have done. You can see the cream on her face. She's having some facial procedures. If she was going to have that and a knee, you're going to need some more. So you have to gauge what's going to be done with it so you can get enough for the procedure. So she's just getting all of the adipose into one syringe so that she can start anew with a different one. So I won't go through the whole procedure, but essentially that's what happens with the adipose aspiration, and then what she's going to do is put some saline into it back and forth to get separation between, say, the lidocaine and the larger fat tissue and the stromal vascular tissue. What you don't want is, once the collection is done, to have a ton of lidocaine remaining in it. And the reason is that lidocaine can be cytotoxic. So these are all techniques that you'll learn in the actual training. So for instance, here she did the procedure. A lot of people are watching. We have it on the big screen. And then the following day, she assists all day long with people doing these procedures and having them. So where do we have these trainings? Well, for the Autologous Adipose SVT, we schedule them throughout the year in places such as San Diego at the Legacy Resort, Nashville at Lowe's Hotel. We do them also in LA and Las Vegas at various locations, either on the Strip or off the Strip. LA usually in a place like Valencia, a beautiful surgery center. We don't need a surgery center. Like I said, this is an in-office procedure. So this is a 2-day course for either the regenerative aesthetics or the comprehensive stem cell. If you'd like, you can come one day early and either have a course in ultrasound-guided injections. Once again, it's hands-on. Or PDO thread lift procedures. PDO thread lifts are an amazing procedure. It's like an internal facelift that is great for patients who either don't need a facelift, don't want to pay for a facelift, or in lieu of a facelift. And everybody who attends the 2-day courses gets a free procedure with exosomes, and you can also do as many of the procedures as you want on those days. So to get started with signing up, you can either call us for more information at 888-998-6343. Visit us at r3medicaltraining.com. You can sign up online there. And if you use the code 10OFF2020, that'll give you 10% off. We're going to keep that code going for a while as a post-COVID special. All right, thanks for watching.